Welcome, everybody. I'm Randy Twaniak, owner of Expedia Cruises, Edmonton West location. It's January 2021, and this is the year that many of us will begin to travel again and see the world. Travel will be different and in some ways more complicated as we deal with COVID issues in our own country and in countries around the world. There will be new rules with each country deciding on its entry requirements. Pre-trip COVID testing may be required. We want to make sure our clients get back to traveling safely and are informed of all the new policies and procedures. My team of 24 professional vacation consultants are here for you, not only to plan your bucket list travels, but to help you navigate through the complexities of travel so that we can help you get back to traveling and doing it safely. Today, we bring you Vicki Lubick, Director of Sales for Paul Gauguin Cruises. Vicki will be letting us know what Paul Gauguin Cruises is doing and has done to make sure you can sail safely. The protocols and safety measures Paul Gauguin has put into place are ever changing based on current scientific data to ensure maximum safety for crew, passengers, and the countries they visit. Welcome, Vicki. Thanks for joining us today.
Hi, Randy. Thanks, everyone. Thank you so much. I really appreciate the opportunity to speak with you about Paul Gauguin Cruises and who we are and what we do, and then also feature our safety protocols that we have in place right now. So I just want to ensure from the beginning here, you are looking at my slide, the Expedia Cruises slide, right, Randy? Okay, great. So yeah, thanks. We thought we'd do just a real quick little talk here, chat about the protocols that are in place and just how traveling, potentially is going to change for the next little while. And Paul Gauguin Cruises, if you're not familiar with who we are and what we do, well, we've been sailing in Tahiti for more than 20 years. And Randy and many of his staff have sailed with us and love the experience. And we have this one beautiful little vessel. It's called the MS Paul Gauguin. It is a small luxury ship, only 332 guests on board. And we sail to the unparalleled wonders of Tahiti and Fiji, the South Pacific, and areas in the South year-round. And we've been doing that, as I said, for more than 20 years. Well, we had many successful sailings in last fall, through the summer and last fall, but as an abundance of caution, we've decided, as the COVID cases increased throughout the world, we decided to pause our operations. And then our ship went into dry dock in January. Actually, just in the last few days, we're taking the ship to a dry dock, which was supposed to have been done last May. So we will come back with upgrades and refurbishments that I'm sure we'll have another talk with you about exactly what that entails, but we'll be back sailing on April 7th of 2021. And as Randy said, the events of 2020 have changed forever, many aspects of our lives, of course. And I believe there still will be the desire to travel the world, and people want to, more than ever, travel with friends and family or solo. And international travel will return, but we agree that there will be some changes in a good way in many cases, of course. Travel will look and feel a little bit different. But know that right now, Tahiti's borders are open. As of July 15th of 2020, the quarantine measures were completely lifted in French Polynesia. So the borders were reopened to international tourism. So folks from all over the world can travel to Tahiti right now. There are a few precautions that you have to keep in mind, and we'll just go through everything from your flight and before departure, and once you're on board the flight, and the various details that you just need to know. And Randy did, at the beginning of the conversation, date this call because I think it's going to be very important to check with your travel advisors to see what the actual rules are in place at the time that you plan to travel, because as we know, these things are quite fluid and they will change as things in the world change as well. So right now, before departure, every traveler needs a negative COVID, and it's important to know this 19 RT-PCR test. So there's many types of COVID tests, but this is the official one that has to be done 3 days prior to departure. And you also must complete an online health document. Now, most of our flights are traveling from Los Angeles to Papeete. Most of our guests, that's where everything connects through Los Angeles. And there are many places in Los Angeles where you can get that test. So if you don't decide to get it in Canada 3 days before, as you're connecting through, you can get it in Los Angeles when you have a layover in Los Angeles. And your travel advisor, of course, can get you more details on where you would do that. There is also an online health document that needs to be prepared, and you do that in advance. You do it online, you take a copy of it with you, and you need to have these documents with you pretty much throughout your flight, when you arrive, and just throughout the time that you're in the destination. You should have these documents, be holding them with you. I did make a note about travel insurance, and of course your travel advisor is really the professional in talking to you about travel insurance, but I want you to know that it's very important that you have travel insurance, because if you don't, or either way, you're required to sign a declaration assuming all medical costs for confinement, repatriation, anything if you should fall ill during your trip. And know that travelers assume all expenses relating to the cost of carrying and confinement and hospitalization and repatriation. So this is something really important to consider. I'm going to talk a lot, mostly about Air Tahiti Nui, really, because that is our travel partner. We always include the flight out of Los Angeles. And if you choose to take flights another way, you can get an air credit. But we do partner with Air Tahiti Nui, and there's entire videos and their website that you can go to that talks about the many different things that they have done on board the flight in terms of safety. But one of the main things is physical distance. Of course, even upon check-in, they've changed the way that you check in for the flights. There are mandatory masks on board the airplane. They provide you with a sanitary kit that includes surgical masks and hand gel and disinfectant. The airplane, as you would expect, is reinforced cleaning and disinfection throughout, prior, more so than ever been done before, prior, afterwards, during. Folks are asked to not travel throughout the airplane any more than necessary, just to keep everyone safe as well. And then the cabin air filtration, actually the filtration that they have is the same as that they have in hospitals. And the airflow does not circulate from one row to the other, and it's renewed every 2 to 3 minutes. I actually didn't realize that. I was very surprised to know that. So it's identical to hospitals, and it captures, they say, 99.9% of the bacteria and viruses in the flight cabin. So that's what happens on your flight. Then you arrive into Tahiti. Mask wearing is required in enclosed spaces, public spaces, of course. And if you're in a large gathering outdoors with a lot of people, their masks are required as well. And when you arrive at the airport, you are given a self-test. So it has an envelope on it. It has the directions on how you do it. It has the oral swab and a nasal swab that you do, and a date on the envelope that you submit then 4 days after you arrive to either the cruise ship or many different hotels or properties once you're there. So you do that second COVID test within 4 days of arrival. So let's say you are doing a pre-cruise stay, or you're traveling to Tahiti between now and April. I just thought I would talk a little bit about how things have changed a bit in the hotels. They do have advanced measures to regulate the flow of passengers or hotel guests throughout the properties. They are limiting the amount of visitors that are allowed from outside the property. So if you're not staying in the hotel, they're not having visitors coming into the hotel. There are additional precautions regarding room service and the amount of times your room will be serviced. Increased hygiene, as you can imagine, and buffets. They have removed all buffets in the hotel properties. So let's talk about welcoming our guests on board. And the picture I have here is a picture of the Gauguins. Those are our troop of Polynesians that are on board the vessel, and they greet you when you arrive. They're your hostesses. They sing and dance, and they do all kinds of crafts and everything. They make our experience a very authentic Polynesian experience. And as always, the safety of our guests has always been the #1 priority. And we have collaborated with our parent company, which is Paul Cruise Lines. They're the only French-owned cruise line. And they've worked with one of the world's leading infectious disease to increase our health protocols. And it's worked on it exceeds international standards. So everything that CLIA, the cruise line industry, have recommended, it far exceeds those standards. And it's built on the principle of double protection. So 100% monitoring of people and goods as they come on board the ship, and then additional scanning and things as well once they're on board the vessel. So as guests arrive, they are required to produce a negative test on board. So let's say you arrive the day before, there is a clinic right at the pier that is open for 2 hours in the morning. You have your COVID test, they guarantee your results by 3 p.m. and that's what time you board the ship. So that works well if you've arrived after 10 o'clock that morning. You have your COVID test on board the ship, and then you're asked to stay into your stateroom until we are able to provide that you do have a negative test. So you have that additional test once you're on board the ship. Every guest will be required to have a health check from medical staff on board. So we're taking your temperatures, and then there's random checks as well throughout the sailing that we have. Luggage will be pre-screened and sanitized, and everyone is provided with sanitary kits. You know, the cruise lines were great anyways for providing hand sanitizer everywhere on the ships. I mean, for many years, before you've gone into any restaurant on any cruise line, there's been the hand sanitizer. So I think the cruise lines were far above what the expectations anyways for many, many years. So that's something that we've been doing anyways. So let's talk a little bit about life on board, and perhaps I thought I'll just kind of point out some of the things you may be wondering and some of the things that could have maybe changed a bit. One of the things is concerns always is fresh air in the staterooms. And there is 100% fresh air in the staterooms. The air conditioning system is a non-circulating type. We have ventilated air in the common areas, and it's renewed every 5 times per hour at least. Our restaurant layouts have all been redesigned to provide less contact, and again, no buffets, so everything is being served a la carte, which to me, I think that's better anyways. Our public spaces have been capped at 50%. As you can imagine, even the number of guests on board the ship has been capped, so we have fewer guests on board. Our ship has always been 20,000 tons, and we've only put 332 guests on board. So for us, this has been a very easy thing to do anyways. We have hourly disinfecting of high touch point areas, so the handles and handrails on board. The crew are required to wear masks. Guests are asked to wear masks in the hallways and in the public areas when you're around other people, if there's like crowds of people around. And I wanted to mention, hospital equipment. Just also know we have a doctor and a nurse on every single sailing. We've always had that. And we do have advanced hospital equipment, including lab services and diagnostic equipment. So we've always had that. And we're always really close to islands as well too, right? So it's very easy to get, if someone does have a medical emergency, it's very easy for us to bring them into the islands as well. I talked about the hand sanitizer, how we've always done that, and pretty much every cruise line has always done that. Oops. A couple other things that have changed a little bit is the restaurants. As I mentioned, we have limited capacity, and we've changed around the seating of the restaurants. What we will be doing right now is opening only one restaurant at a time. The water sports marina will still be open. We have the paddleboarding and the kayaking from the water sports marina. Our shore excursions, we've always had small groups of folks on our shore excursions anyways, but they'll be even further limited. I think the most we've ever had on a shore excursion is maybe 12 people anyways. So this is, as you can kind of see, some of these changes are kind of easy for us. But you will have regular shore excursions like you've always had. When you're on, let's say, the tender taking you into the islands, we're asking you to wear a mask. When you come back to the ship, you'll have your temperature checked. Mota Mahana is our private beach retreat. That's the bottom picture I have there. It's a highlight for our guests, and it always has been. It is so much fun, and we have beach barbecue here. We have floating bar, and the water here is 28 degrees year round. And Mota Mahana will still be open, and the only difference is we don't have the buffet for the barbecue. It's this amazing, sumptuous barbecue. It will be served a la carte as well. We have taken away the snorkel gear. We are asking people to bring their own snorkel gear, or we can sell you your own. I think for sanitary reasons, you want to have your own mouthpiece as well, but we do have the fins for you still. The scuba diving gear is all being supplied as well. We do have an additional fee for scuba diving. We always have been, but it is nominal. Spa is open for many of the services that we have. The spa is still open, and the Polynesian blessing ceremony is still available. So for those of you that are celebrating a milestone birthday or an anniversary, this is a beautiful way to commemorate that, and we are still doing that as well. So what just changed is going to change in the next few days is guests that are returning to Canada are required to have a negative COVID test as well within 3 days of their return. There is a clinic in Papeete, and this has just been announced in the last few days. I know we are working on having the ability to do the tests on board the vessel as well, but I can't confirm that. But certainly April onwards, by the time you're traveling, Randy and the travel advisors at Expedia Cruises will be able to tell you more about that and tell you exactly how you'll be able to get that test, but we will make it easy for you. I do want to point out, a little bit about French Polynesia. It is spread out over the ocean the size of Europe. It's 118 islands. The landmass is only the size of Prince Edward Island. The total population is only 180,000 people as compared to Hawaii, which has 1.4 million people. Tahiti in a year receives the same amount of tourists as Hawaii receives in just 7 days. So it's just a beautiful, unspoiled paradise. And I have here social distancing comes naturally. And I think that's why Tahiti was able to open its borders so early like this as well. There's plenty of fresh air and wide open spaces. The island of Tahiti just naturally offers a safe and serene environment. So I think it will be an easy place to consider when you're thinking about going back to traveling. And just quickly, why Paul Gauguin Cruises? Well, we have this beautiful, intimate, small ship. And thanks to our all-inclusive pricing, guests are able to enjoy everything and not have to worry about every little detail because everything's been taken care of, from your onboard dining, onboard gratuities. We have an open bar on board once you're on the vessel. So there's so much more, and everything is included once you're on board the ship. And just in closing, I love that. I'm a huge fan of Charlie Brown and Snoopy. I'm probably showing my age here, but my girlfriend sent me this at Christmas time, and I just love what this says. But I just want to say that I believe, and we believe at Paul Gauguin Cruises, that the world crisis has forced us to look inwardly at the quality of our lives and the time that we spend when we're not working, right? And we want it to have more meaning. Once this passes, people will continue to do things that are important to them. And travel is and always has been on that list. So we look forward to having you return to French Polynesia and return to the Paul Gauguin, and of course do that with Randy and the professional folks at Expedia Cruises in Valley View. So Randy, do you have anything to add? Because I know you've been on board the ship as well.
Excellent, Vicki. If I could have you unshare your screen.
Oh yeah, I certainly will. Yeah.
Vicki, that was excellent information.
Thank you.
When I was on a few years ago on board, it was the best vacation of my life. I know now there's a few things that we'll need to do extra when going to Tahiti, but seeing Tahiti makes it all worthwhile. I mean, Tahiti, French Polynesia, as you know, is absolute paradise, and probably the easiest place on earth to social distance. We definitely appreciate everybody taking time to watch this video. We look forward to helping you on your future trips.
Thank you. Meruru.